This week we're going to talk about imaging, nuclear medicine, and radiation oncology. You will learn the key terms associated with these sections. You will learn the codes associated with imaging, nuclear medicine, and radiation oncology sections of ICD-10 PCS. You will identify the 7-character codes and the differences among the sections of radiology. You will learn the different types of imaging procedures for ICD-10 PCS, and you'll be able to code procedures from the imaging, nuclear medicine, and radiation oncology section of ICD-10 PCS. Radiology is the study of X-rays, high-frequency sound waves, and high-strength magnetic fields, and it sometimes includes the use of radioactive compounds to diagnose and/or treat disease or injuries. Unlike ICD-9-CM Volume 3, ICD-10 PCS has broken down the radiology section into 3 distinct sections with their own tables. You have the imaging section, the nuclear medicine section, and the radiation oncology section. Let's talk about the imaging section first. The imaging procedure codes include codes for plain X-ray services, ultrasound, fluoroscopies, CT scans, and MRI scans. The ICD-10 PCS imaging section codes begin with the letter B in the first character position to identify imaging codes. The second character for the imaging codes identifies the body system on which the service is performed. The third character is the type or the root type of imaging procedure. The types of imaging procedures are plain radiography, computerized tomography, ultrasonography, fluoroscopy, and magnetic resonance imaging. The fourth character position identifies the body part imaged. Attention to detail is important in this value choice because very specific sites are noted in this column of the table for the imaging section. The fifth character identifies whether contrast material is used and whether the material was high osmolar contrast material or low osmolar contrast material. High osmolar contrast material has a higher level of particle concentration than normal body fluid. The low osmolar contrast material has a lower level particle concentration than normal body fluid. Contrast material might be injected when some of the imaging services are performed. Character 6 is considered a qualifier, the same as character 7 is considered a qualifier, and they identify further detail as needed. Character value 6, they identify unenhanced followed by enhanced or laser. Typically for this section, the value is Z, none. Nuclear medicine treats and diagnoses diseases using small amounts of radioactive material called radioactive isotopes, which create an image. The value identifying the nuclear medicine section is the letter C. The body system on which a nuclear medicine procedure is performed is identified by the second character position. The value depends on the part of the body being tested and the table being referenced. The third character in the code identifies the type of procedure being performed. You can have planar nuclear medicine imaging, which has a value of 1, tomographic nuclear medicine imaging, which has a value of 2, positron emission tomographic imaging, or PET, has a value of 3, non-imaging nuclear medicine uptake, which has a value of 4, non-imaging nuclear medicine probe, which has a value of 5, non-imaging nuclear medicine assay, which has a value of 6, and systemic nuclear medicine therapy, which has a value of 7. And it is important that the coder knows the definition for each of these different types of procedures. The fourth character in the nuclear medicine section identifies the body part or region being studied. The values for each body part or region vary depending on the table being referenced, but they are the same within one body system or region. A radionuclide, also called a radioactive isotope, is a radioactive substance that can either be found in nature or human-made, and that is the source of the radiation causing the emissions so that an image can be produced. These radionuclides indicate the location, size, or function of organs, tissues, or vessels. Radioactive material is used to aid in the determination made with regards to a patient's condition. These radionuclides are represented in the fifth character position in the nuclear medicine tables. The sixth and seventh character positions are both qualifiers. For the nuclear medicine section of ICD-10 PCS, a Z value is always in these positions because there are no specified qualifiers for this section at this time. Radiation oncology is a form of radiology that is therapeutic as opposed to diagnostic in nature. The patient is typically undergoing treatment for a malignant neoplasm. The aim is for the radiation to eradicate or shrink the neoplasm or obstruction, relieving pain. Radiation oncology codes begin with the section value of D. Character 2 represents the body system, and it specifies the body system that is being treated. You have central and peripheral nervous system, which has a value of 0, lymphatic and hematologic system, which has a value of 7, eye, value of 8, ear, nose, mouth, and throat, value of 9, respiratory system, value of B, gastrointestinal system, value of D, hepatobiliary system and pancreas, value of F, endocrine system, value of G, skin, value of H, breast, value of M, musculoskeletal system, value of P, urinary system, value of T, female reproductive system, value of U, male reproductive system, value of V, and anatomical regions with a value of W. Modalities in medicine means a certain protocol, therapeutic method, or agent such as chemotherapy, brachytherapy, radiosurgery. Modalities are valued in the third character position. The fourth character identifies the specific treatment site that is the target of the radiotherapy. The fourth character value changes as the body system changes. Example, the value of 0 in the central and peripheral nervous system indicates the brain, whereas in the lymphatic and hematologic system, the value of 0 indicates bone marrow. The fifth position is for the modality qualifier. This position further clarifies the radiation modality as identified in the third character. Examples include photons, electrons, heavy particles, neutrons. Character 6 identifies the isotope. An isotope is one of two or more atoms that contain the same atomic number but have different mass numbers in the nucleus. The same radioactive isotopes discussed in the nuclear medicine section are found in the radiation oncology section, and they are identified in the sixth character position. Character 7 is your qualifier position. There is no specified qualifier for the radiation oncology section, so the value is always none, which is indicated by the letter Z. So let's go over some key points. Radiology allows internal structures of the body to be imaged. A radiologist is a doctor who specializes in radiology. The use of contrast materials allows for enhanced identification of abnormalities. Nuclear medicine treats and diagnoses diseases using small amounts of radioactive material. Radioactive material, also known as isotopes, helps to create nuclear medicine images. The term modality indicates a certain protocol, therapeutic method, or agent used for treatment. Examples of modalities include chemotherapy, brachytherapy, stereotactic radiosurgery. Okay, let's do a practice coding exercise. Select a code for the following: MRI of the thyroid gland. And the answer is BG34ZCZ. B for imaging, G for endocrine system, 3 for MRI, 4 for thyroid gland, Z for none, Z for none again, and Z for none for the qualifier.